Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. We've known for some time that changes occur in the brain as much as 20 years prior to the occurrence of Alzheimer's disease symptoms. Now, studies also show that there are ways to prevent these changes from occurring in many cases, and even reverse them if changes are detected in the early stages. Now, functional MRI scans of the brain are one way to detect these changes, but in May 2025, the U.S. FDA approved the first ever simple blood test for early detection of Alzheimer's disease changes. The blood test is called the LumaPulse test, and this test essentially indicates if your brain is building up abnormal tau protein, which leads to neurofibrillary tangles, and it measures the amount of beta amyloid protein. Now, neurofibrillary tangles and beta amyloid plaque buildup are two hallmark features of Alzheimer's disease, and that's what this blood test is measuring. So this simple blood test enables doctors to identify at-risk individuals many years before the onset of symptoms and/or helps to confirm the diagnosis of Alzheimer's disease in those who already have symptoms. Now, this blood test should be viewed as a gold standard, non-invasive procedure that every adult 55 years of age and older should undertake for the sake of prevention, in my view. Now, based on the results of the blood test, it helps practitioners like me decide how aggressively a person needs to be involved in warding off Alzheimer's disease regarding targeted nutrition, exercise, and dietary supplementation practices, all of which have been shown to help prevent and reverse the buildup of neurofibrillary tangles and beta amyloid plaque, and reverse early-stage dementias as reported in many human clinical studies in recent years. As the FDA Commissioner, Dr. Martin Makary, commented, Alzheimer's disease impacts too many people, more than breast and prostate cancer combined. And he went on to say, knowing that 10% of people aged 65 and older have Alzheimer's, and that by 2050 that number is expected to double, I'm hopeful that new medical procedures like this one, this new blood test, will help patients. For people with diagnosed Alzheimer's disease, PET scans and newly approved infusion drugs can be used to better view brain changes and help remove some beta amyloid plaque. Now, these imaging tests and monoclonal antibody drugs are also approved by the FDA, and financial coverage is available with specific conditions in the United States. But for people 55 and older who do not yet have symptoms of dementia, this new blood test is a game changer in terms of assessing future risk of Alzheimer's disease. And with the plethora of nutrition and lifestyle medicine research that's been published in recent years, we now know how best to combat and reverse brain changes leading to dementia and Alzheimer's disease. So the bottom line is to be proactive. So how do you get access to testing and counseling like this? In North America, the pharmaceutical company Algernon Pharmaceuticals, who acquired No Brainer Imaging Centers in 2025, is planning to offer this new Alzheimer's blood test and a host of follow-up services, including personalized nutrition and lifestyle counseling to adults 55 and older by the third quarter of 2025. Services also include access to brain PET scans where indicated, as well as drug therapies for Alzheimer's disease and related Alzheimer's detection and intervention solutions. So keep your eye on Algernon Pharmaceuticals, who are getting set to open a number of Alzheimer's prevention and treatment clinics throughout North America, and who will provide everyday consumers with access to remote genetic and blood testing access for Alzheimer's disease, as well as internet-based and in-person nutrition and lifestyle counseling that is personalized to the patient's Alzheimer's risk profile. This approach will help prevent many cases of Alzheimer's disease, in my view, and it's a very exciting, a very timely, much-needed service. So I've provided the reference for the FDA announcement and some related documents in the text below. Thanks for watching, and I'll see you next time.